If you want to improve your prostate health, every factor from your daily habits to your sitting position can be important. Experts emphasize that sitting for extended periods and incorrect sitting positions can disrupt blood circulation in the prostate area and increase inflammation. Optimizing your sitting position can reduce pressure on your prostate and support your overall prostate health. Research shows that modern men spend an average of 9.5 hours sitting each day, with office workers often exceeding 11 hours. This sedentary lifestyle represents a dramatic shift from our evolutionary past and creates sustained pressure on pelvic structures, including the prostate gland, which sits directly beneath the bladder in an area impacted by sitting posture. Yet what many men don't realize is that not all sitting positions affect the prostate equally. What's particularly encouraging is that simple adjustments to sitting habits can potentially reduce prostate pressure by 30 to 50% according to biomechanical studies, creating immediate relief and possibly contributing to long-term prostate health. Let us know where you're watching from and how old you are in the comments below. The connection between sitting posture and prostate health has gained increasing attention from urologists and ergonomics specialists. What's consistent across these experts' observations is that prolonged sitting in certain positions creates pressure points that can compress blood vessels, restrict circulation, and potentially exacerbate inflammation in the prostate region. When researchers first began investigating the relationship between sitting habits and prostate conditions, many were surprised to discover significant differences in pelvic floor pressure measurements between various sitting positions. However, as our understanding of pelvic anatomy and biomechanics has advanced, the mechanisms behind these effects have become increasingly clear. I'm Dr. Rachel, and for over 25 years, I've specialized in urology with a focus on prostate health and non-pharmaceutical approaches to managing prostate conditions. Today I'll share information about how your sitting position affects your prostate health, adjustments that, when implemented consistently, might help reduce symptoms and support better prostate function. Before we explore these sitting recommendations, I'd like to ask you to subscribe to our channel and turn on the notification bell. Each week, we share evidence-based approaches to men's health focused on practical, accessible strategies. If you're interested in ways to support your prostate health through lifestyle modifications, you won't want to miss our upcoming videos. These sitting positions are worth examining because they directly influence the mechanical pressure, blood circulation, and temperature regulation around the prostate, factors that can significantly affect prostate symptoms and long-term health. To understand why sitting position matters so much, let's first look at the prostate's location and how sitting affects it. The prostate gland is located deep in the pelvis, just below the bladder and surrounding the urethra. When seated, especially on firm surfaces, pressure is transmitted through the pelvis to the perineum, the area between the scrotum and anus. This pressure can compress the prostate directly or indirectly by compressing blood vessels and lymphatic channels that serve the prostate region. Prolonged compression affects the prostate in several ways. It can impede blood flow, potentially contributing to congestion and inflammation. It can increase local temperature, which may affect prostatic function, and it can create mechanical stress on pelvic floor muscles that support the prostate, potentially leading to tension and discomfort that exacerbates urinary symptoms. With these mechanisms in mind, let's examine how different sitting positions affect prostate health and which adjustments can help reduce pressure and support better prostate function. The impact of different sitting positions on prostate health. The first critical aspect of sitting that affects prostate health is the distribution of weight through your sitting bones, ischial tuberosities, and how this influences pelvic tilt. The position of your pelvis while seated directly affects the amount of pressure transmitted to the prostate region. When sitting with a posterior pelvic tilt, where the lower back is rounded and the tailbone is tucked under, pressure increases significantly on the perineum and prostate area. This slouched position, common among office workers and drivers, creates a direct line of pressure from the sitting surface through the perineal tissues to the prostate gland. Biomechanical measurements show that this position can increase pressure on the prostate region by up to 40% compared to neutral sitting positions. Conversely, sitting with an anterior pelvic tilt, where the lower back is arched excessively, shifts pressure away from the perineum but creates other issues. This position increases pressure on spinal structures and can lead to compensatory tension in pelvic floor muscles, potentially contributing to chronic pelvic pain that may exacerbate prostate symptoms. The ideal position appears to be a neutral pelvic tilt, where the natural curves of the spine are maintained. In this position, weight is distributed optimally through the sitting bones, reducing direct pressure on the perineum while maintaining proper alignment of pelvic structures. Studies using pressure mapping technology show that this neutral position reduces perineal pressure by approximately 30 to 50% compared to slouched sitting. To achieve this neutral position, sit with your weight evenly distributed on your sitting bones, maintain the natural inward curve of your lower back, not excessively arched but not flattened. Position your feet flat on the floor, and keep your knees at approximately hip level or slightly lower. Some men find that a small, rolled towel in the lower back helps maintain this neutral position, especially in chairs that lack proper lumbar support. The second key factor is the sitting surface itself, which significantly affects how pressure is distributed through the pelvic region. Hard, flat surfaces concentrate pressure on the perineum, while properly designed cushioning can help distribute this pressure more evenly and reduce the load on sensitive structures. Conventional office chairs often have flat or minimally contoured surfaces that fail to accommodate pelvic anatomy optimally. Research using pressure sensors shows that these surfaces concentrate pressure directly under the perineum, precisely where you don't want it for prostate health. Specialized cushions with a center cutout or channel specifically designed to reduce perineal pressure can make a significant difference. These cushions, sometimes called prostate cushions or coccyx cushions, remove pressure from the central perineal region and redistribute it to the sitting bones, where it causes less potential harm. Studies measuring perineal blood flow demonstrate that these cushions can improve circulation by up to 35% compared to standard flat seating. For men who spend many hours seated, investing in an ergonomic chair with proper lumbar support and a well-designed seat pan can make a substantial difference in prostate health. Features to look for include adjustable seat tilt, which helps maintain proper pelvic position, contoured cushioning that distributes pressure away from the perineum, and sufficient depth to support the thighs without creating pressure behind the knees, which can affect circulation to the lower pelvis. The third critical aspect is sitting duration and movement breaks, which affect how long tissues are subjected to compression and restricted circulation. Even the most ergonomically perfect sitting position becomes problematic when maintained without interruption for extended periods. Research clearly shows that prolonged static sitting is detrimental not only to prostate health but to overall metabolic and cardiovascular function. Studies measuring inflammatory markers find significant increases after just 60 to 90 minutes of uninterrupted sitting, even in healthy individuals. For men with existing prostate conditions, this inflammatory response may be more pronounced and potentially exacerbate symptoms. The optimal approach appears to be incorporating regular movement breaks throughout periods of sitting. Standing and walking briefly every 30 to 45 minutes reestablishes blood flow, reduces tissue compression, and helps reset tension in pelvic floor muscles. Even 30 to 60 seconds of movement can make a difference, though 2 to 5 minute breaks appear to provide more significant benefits for tissue recovery. For men who need reminders to take these breaks, various apps and computer programs can provide regular prompts. Some ergonomic experts recommend the 30-30-30 rule: for every 30 minutes of sitting, stand for 30 seconds and take 30 steps, providing both relief from sitting pressure and minimal but beneficial movement. Robert, a 67-year-old with BPH, benign prostatic hyperplasia, who worked as an accountant, found that adjusting his sitting position made a noticeable difference in his symptoms. "I was spending 9 to 10 hours daily at my desk, and my urinary frequency and discomfort were getting worse despite medication," he explains. "When my urologist suggested that my sitting habits might be contributing to my problems, I was skeptical but willing to try adjustments." After implementing proper sitting posture with a specialized cushion and regular movement breaks, Robert experienced significant improvements. "Within about 2 weeks, I noticed I was getting up less frequently at night to urinate, and the persistent pressure sensation I'd been feeling had diminished considerably. It wasn't a complete cure, but the improvement was substantial enough that my doctor was able to reduce my medication dosage." What surprised Robert most was how these simple changes affected other aspects of his health. Beyond the prostate benefits, my back pain improved, I had more energy throughout the day, and I even noticed better concentration. I hadn't realized how much my poor sitting habits were affecting my overall well-being. Specific sitting recommendations for different prostate conditions. While the general principles of healthy sitting apply to all men, specific prostate conditions may benefit from tailored approaches. Let's examine how sitting modifications can be optimized for particular prostate issues. For men with benign prostatic hyperplasia, BPH, the enlarged prostate is more susceptible to compression effects and restricted blood flow. For these men, slightly elevating the hips above knee level, using a wedge cushion with the thicker portion at the back, can help reduce direct pressure on the perineum while maintaining good overall posture. This position creates a gentle anterior pelvic tilt that shifts weight slightly forward onto the thighs and away from the perineal area. Additionally, men with BPH may benefit from dynamic sitting approaches that incorporate subtle movement even while seated. Sitting on an exercise ball, with proper back support, for portions of the day, using a chair that allows gentle rocking or movement, or simply performing periodic pelvic tilts while seated can help maintain circulation and reduce prolonged compression. For men with prostatitis or chronic pelvic pain syndrome, sitting can be particularly problematic, often directly triggering or worsening pain. These men typically benefit from cushions specifically designed to completely offload pressure from the central perineum, such as donut cushions or more sophisticated models with gel inserts that contour to individual anatomy. Men with these conditions should be particularly attentive to maintaining proper pelvic floor relaxation while seated, as tension in these muscles can exacerbate pain. Periodic drop and relax exercises while seated, consciously releasing tension in the pelvic floor muscles for 10 to 15 seconds, can be helpful. Some physical therapists recommend visualization techniques, imagining the pelvic floor softening and dropping downward while breathing deeply. For men recovering from prostate surgery or procedures, sitting modifications are especially important to prevent undue pressure on healing tissues. During recovery, softer surfaces with excellent pressure distribution are typically recommended, along with more frequent position changes and shorter sitting durations. Some urologists recommend limiting sitting to 20 to 30 minutes at a time during the early recovery period, gradually increasing as healing progresses. Thomas, a 72-year-old with chronic prostatitis/chronic pelvic pain syndrome, found that specialized sitting modifications were transformative for his condition. My pain was often unbearable after sitting for even short periods, which severely limited my activities and quality of life, he shares. After working with a pelvic floor physical therapist, I discovered that my sitting position was a major trigger for my symptoms. Thomas implemented a comprehensive approach to sitting. I now use a specialized cushion with a cutout design that completely removes pressure from my perineal area. I've adjusted my car seat and home furniture with proper supports, and I'm religious about taking movement breaks every 20 to 30 minutes. These changes, along with pelvic floor relaxation techniques, have reduced my pain levels dramatically. What Thomas found particularly valuable was regaining activities he had abandoned. I had stopped going to movies, attending sports events, or enjoying meals at restaurants because sitting was so painful. With my new approaches to sitting, I've been able to reclaim these activities and the social connections that come with them. The improvement in my quality of life has been profound. Let us know where you're watching from and how old you are in the comments below. While these sitting modifications provide a good foundation for supporting prostate health, there are several additional considerations that might enhance their effectiveness, particularly when integrated with other lifestyle approaches. Additional strategies to enhance prostate health while sitting. For men who must sit for extended periods professionally, alternating between sitting and standing work positions can provide significant benefits. Standing desks or sit-stand workstations allow for position changes throughout the day without interrupting productivity. Research suggests that splitting the workday between sitting and standing positions, perhaps 50-50 or 60-40, provides optimal benefits for both prostate health and general metabolic function. When using a standing desk, proper ergonomics remain important. Standing statically for too long creates its own issues. Anti-fatigue mats, periodic weight shifting, and proper monitor and keyboard height all contribute to making standing work comfortable and sustainable. Many men find that gradually increasing standing time works better than abrupt changes, starting with perhaps 20 minutes per hour and slowly extending. For men who drive frequently, vehicle seating presents particular challenges for prostate health. Car seats are rarely designed with prostate health in mind, and vibration during driving can exacerbate the effects of poor sitting posture. Aftermarket seat cushions designed specifically for driving can make a significant difference, as can adjusting the seat position to maintain proper pelvic alignment. During long drives, more frequent stops are beneficial. Aim for a 5-minute break every hour to walk and stretch. Subtle techniques like alternately tensing and relaxing the buttocks muscles while driving can help maintain blood flow to the pelvic region. Some men also find that slightly adjusting their position every 10 to 15 minutes, even while remaining seated, helps reduce continuous pressure on any one area. For air travel, which often involves prolonged sitting in particularly confined and uncomfortable seating, preparation is key. Booking an aisle seat allows for easier movement breaks without disturbing other passengers. Bringing a portable, inflatable, or foldable ergonomic cushion can significantly improve seating comfort. Staying well hydrated, while balancing the need for bathroom access, helps maintain healthy circulation and reduces inflammation. James, a 69-year-old sales representative who drove approximately 30,000 miles annually for work, found that vehicle seating modifications made a tremendous difference in his prostate symptoms. "My car became a torture chamber as my prostate issues worsened," he explains. Long drives would leave me with increased urinary frequency and discomfort that would persist for days afterward. After implementing specialized cushioning and new driving habits, James experienced substantial relief. "I invested in a high-quality driving cushion with pressure relief for the perineal area, adjusted my seat position to maintain better pelvic alignment, and now I stop every 45 to 60 minutes for a quick walk around. These changes have made my work travel much more comfortable and prevented the flare-ups I used to experience after long drives." What James found particularly effective was developing a pre- and post-drive routine. "I now do a specific set of stretches focused on the lower back and hips before getting in the car and again after reaching my destination. This routine seems to reset my pelvic area and prevent the tension that used to build up during drives. My urologist is impressed with how these simple changes have improved my symptoms." The science behind sitting and prostate health. The recommendations for these sitting modifications are supported by both clinical research and biomechanical studies. Understanding this evidence can help motivate consistent implementation of healthier sitting habits. Pressure mapping studies have quantified the effects of different sitting positions on perineal pressure. Research published in the Journal of Urology used specialized pressure sensors to demonstrate that slouched sitting increases pressure on the perineum by 36 to 44% compared to sitting with neutral pelvic alignment. These same studies showed that specialized cushioning with central cutouts reduced perineal pressure by up to 50% compared to standard flat surfaces. Blood flow studies provide further evidence for the effects of sitting on prostate health. Using Doppler ultrasound technology, researchers have measured significant reductions in blood flow to the pelvic region during prolonged sitting, particularly in compressed positions. One study found that after 60 minutes of sitting on a hard surface, blood flow to the prostate region was reduced by approximately 25%, while the use of properly designed cushioning limited this reduction to about 10%. Clinical outcome studies, while limited, suggest that sitting modifications can improve symptoms for men with various prostate conditions. A study published in the International Journal of Urology followed men with chronic prostatitis/chronic pelvic pain syndrome who implemented sitting modifications and regular movement breaks. After 12 weeks, participants showed an average 33% reduction in symptom scores compared to controls who maintained their usual sitting habits. Beyond these direct studies, broader research on inflammation and circulatory health supports the mechanisms behind these recommendations. Prolonged sitting has been shown to increase inflammatory markers throughout the body, while even brief movement breaks can significantly reduce these markers. Since inflammation plays a key role in many prostate conditions, these findings provide additional support for the importance of sitting habits. Now, I want to share what might be the most important factor for successfully implementing these sitting modifications, something that experts in ergonomics and behavior change consistently emphasize. The key factor appears to be creating environmental cues and systems that support consistent implementation rather than relying solely on remembering to maintain good posture. Physical reminders and environmental modifications, like ergonomic chairs that naturally promote proper positioning, cushions that make improper sitting uncomfortable, or timer apps that prompt movement breaks, are typically more effective than willpower alone for maintaining healthy sitting habits. It's also important to recognize that adaptation takes time. When first implementing new sitting positions, you might experience some discomfort as your body adjusts to different muscle engagement patterns. Starting with shorter periods in the new positions and gradually extending the time often leads to more successful long-term adoption. Michael, a 74-year-old retired executive who implemented these sitting modifications after developing prostatitis, emphasized the importance of systematic implementation. Initially, I tried to simply remember to sit better, but I would inevitably slip back into old habits as I became focused on activities, he shares. What finally worked was redesigning my environment to support better sitting automatically. Michael's approach included several key elements. I replaced my home office chair with an ergonomic model that makes proper sitting easy and improper sitting uncomfortable. I set up automatic reminders on my computer that prompt movement breaks every 30 minutes. And I placed visual cues, small colored stickers, on furniture throughout my house to remind me to check my posture whenever I see them. After maintaining these practices for several months, Michael experienced significant improvements. My prostate symptoms have decreased substantially, less frequent urination, reduced discomfort, and better overall quality of life. What began as a specific effort to address prostate issues has become a broader improvement in how I treat my body throughout the day. What Michael found most valuable was how these changes became automatic over time. After about 3 months of consistent practice with my environmental supports, I realized I was naturally sitting in healthier positions without conscious effort. The conscious practices had become unconscious habits, making it much easier to maintain them long-term. For those interested in implementing these sitting modifications, I recommend starting with an assessment of your current sitting environment and habits. Notice where and how you sit throughout the day, which positions tend to exacerbate symptoms, and what environmental factors might be contributing to poor sitting habits. Based on this assessment, prioritize changes that address your most problematic sitting situations first. For many men, this is their work environment, where they might spend 6 to 8 hours daily. Investing in proper ergonomic furniture and cushioning for these primary sitting locations often provides the greatest return on investment for symptom improvement. Remember that these changes are beneficial not only for prostate health but for overall well-being. The same sitting modifications that reduce pressure on the prostate also support better back health, improved circulation, reduced risk of deep vein thrombosis, and enhanced energy levels and cognitive function. This broader perspective can help maintain motivation for implementing these changes. Let's summarize the key recommendations for prostate-healthy sitting. Maintain neutral pelvic alignment while seated, avoiding both excessive posterior tilt, slouching, and anterior tilt, arching. Distribute weight evenly through the sitting bones rather than the perineum. Use appropriate cushioning that reduces perineal pressure, such as ergonomic chairs with contoured seating or specialized cushions with central cutouts designed to reduce pressure on the prostate region. Incorporate regular movement breaks, ideally standing and walking briefly every 30 to 45 minutes to re-establish blood flow and relieve pressure on pelvic tissues. Consider specific modifications based on your particular prostate condition: slight elevation of the hips for BPH, complete perineal offloading for prostatitis, or softer surfaces and shorter sitting durations after procedures. Implement environmental supports like ergonomic furniture, timer apps for movement breaks, and visual reminders to help maintain healthy sitting habits consistently. For those who must sit extensively for work, consider alternating between sitting and standing positions throughout the day using adjustable workstations. Pay special attention to challenging sitting environments like vehicle seating and air travel, using specialized cushions and more frequent breaks to minimize negative impacts. By implementing these evidence-based sitting modifications consistently, you may be able to significantly reduce pressure on your prostate, improve blood flow to pelvic tissues, and potentially experience meaningful reductions in prostate-related symptoms. While not a replacement for appropriate medical care for prostate conditions, these approaches offer a complementary strategy that addresses a fundamental but often overlooked factor affecting prostate health. If you found this information valuable, please consider sharing this video with others who might benefit. Many men experience prostate issues as they age but are unaware of how significantly their sitting habits might be contributing to these problems. Subscribe to our channel for more evidence-based approaches to men's health, and tap the notification bell so you never miss an upload. Each week, we explore different aspects of well-being for men, always focused on practical, accessible strategies. Thank you for joining me today. I wish you comfort and health in the days ahead. Until next time, take good care of yourself.